duct. The rate of filtration determines which solute and how much water is retained. So remember this number, only about 10 millimeter of mercury pressure difference. So how do you control the blood flow? When you control the diameter of the arteriole, remember there is like a hose. The more you squeeze, the more pressure it will be. Okay, and in the beginning I talked about it. So this is where the neuronal nerve comes into play. When you rest, sympathetic stimulation is low. Then you have vasodilation, and then you have increased blood flow, more filtration. But when you're stressed out, sympathetic comes into play, vasoconstriction, and which too much pressure going through, which direct the blood or the organ, and then you have less filtration. Again, a summary: if your blood pressure drop, sympathetic stimulate, the renin will release in the in the macula densa and juxtaglomerular apparatus, and then it will lead to angiotensin II formation in the lungs, and then vasoconstriction, and then the secretion of aldosterone, which will increase sodium and water absorption. Autoregulation, it just means homeostasis. Okay. Need to regulate blood flow in spite of changes in the blood pressure. Pressure goes down when we sleep and up when we exercise, but filtration rate needs to be maintained. So it's always pretty much the same with myogenic regulation and tubuloglomerular feedback. So all these things are playing, always sending information back. The myogenic mechanism is the smooth muscle in the arteriole. If it's stressed, if it's stretched, the muscle contracts. If there's no stretch, the muscle will relax. Increased blood pressure equals increased stretch. Then you have a vasoconstriction, and then it will control the flow this way. Autoregulate the tubuloglomerular feedback. Again, you're either going to contract or relax the afferent arteriole. Remember, the afferent is the one that's going in. It will contract or relax. And remember, the afferent tube is always a little bit bigger. Okay. Juxtaglomerular apparatus to the paracrine signaling, the macula densa, the fluid flow rate of sodium concentration. Remember, this is the one that can detect low blood pressure, the macula densa. If the glomerular filtration rate will increase, okay, then there's less time for the proximal convoluted tubule to absorb sodium and chloride, so high osmolarity to filtrate flow in the distal convoluted tubule. So the more increases, okay, blood is going through faster, okay, proximal convoluted tubule, because it's going faster, it doesn't have time to absorb as much, okay. The macula densa will release the paracrine substance that causes juxtaglomerular cell to constrict to decrease the flow. If glomerular filtration rate decrease, lowering the sodium means no release of the paracrine. So this is just the opposite of this one. Hormonal regulation of the kidney function. This is actually a summary, but a little bit more detail. Okay, endocrine and paracrine, mostly involved in the stimulation or inhibiting blood flow through the kidney and blood concentration, osmolarity of maintaining. So renin, angiotensin, aldosterone is vasoconstriction. Antidiuretic hormone, we know what that is. It absorbs more water. Endothelin is vasoconstriction as well. Natriuretic hormone, this is absorption of more sodium. And parathyroid hormone is for the calcium. If blood pressure decreases. The renin activate, this is the one I talked to you about. Angiotensin 1, angiotensin 2 will cause vasoconstriction, and then the release of aldosterone, release of ADH, and endothelin is a powerful vasoconstrictor. Okay, so that's just a summary. Blood volume, natriuretic, if it's increased. Okay, so the other one was whenever it decreases. This is whenever the macula densa and juxtaglomerular apparatus will detect the decrease. Now, what happens when there's an increase? Natriuretic hormone will get rid of the sodium. Okay, so this is anti-aldosterone. Okay, and anti-ADH. Okay, sodium stays in the filtrate and water stays in. Atrial hormone, when atria is stretched, it increases the glomerular filtration rate by dilating the afferent and constricting the efferent, as well as decreasing reabsorption. Okay, so if you read this slowly, atrial neuritic hormone, okay, whenever the atria in your heart is stretched, it will increase the filtration rate by dilating the afferent artery. Remember the afferent artery, making it bigger, okay, and making the constricting the efferent, making the exit smaller, okay, as well as decreasing the sodium absorption of the distal convoluted tubule. Regulation of fluid volume. Volume and osmolarity must be preserved. Blood volume influences the blood pressure. So the more volume, of course, the higher pressure, okay. You also have baroreceptors, causes vasodilation when stimulate, increased pressure. So remember, we have some baroreceptors in the in your jugular and carotid, and sometimes when you get older, they don't work as well. You stand up too fast, they don't constrict, and then your blood pressure drops, and then you start feeling, seeing black and lightheaded. Okay. So all this is just a summary to the end. Blood volume changed by hormone. Okay, you can read all of these. Regulation of blood composition. Sodium is strong water attract. So everywhere sodium goes, water will go. Okay, except in remember the ascending part of the loop of Henle, water comes out. Sodium is reabsorbed, but water cannot leave. Okay, largest role in the plasma osmolarity. So wherever sodium goes, potassium usually get excreted. Okay, but sodium goes with chloride. Too much sodium means more water, and hypertension increase the risk of heart attack, stroke, aneurysm, edema. So you need aldosterone, NAH, ADH to control the concentration. Calcium, remember we talked about parathyroid. Parathyroid is stimulated when there's a calcium decrease, and then it will cause the osteoclast to start getting more calcium, causing your intestine also to absorb more calcium. Parathyroid hormone stimulate kidney to convert calcidiol to calcitriol, which is the active form of vitamin D. pH, remember protein, carbonic acid, and ammonia have large capacity to absorb or release hydrogen, which will affect the pH. The kidney can get rid of the body of acid or base by changing the secretion and absorption of hydrogen and carboxyl. Okay, the pH of the blood decrease when the proximal convoluted tubule and collecting duct will secrete more hydrogen. So if you look back at that picture, nitrogen waste comes from the breaking down of protein. Amino acids are deaminated Okay, amine group is converted into ammonia. Ammonium ion, urea, and uric acid are excreted. Okay, that's at the end. This is how urine is formed, and some drugs. Summary. So your system and function depends on function of the kidney. Vitamin D synthesis, allow calcium absorption. Calcium is bone health. Calcium also help with muscle contraction, if you remember the chapter on muscle. Hormone secretion, neurotransmitter release, and there are receptors for vitamin D on many cell body. Erythropoiesis is making more red blood cells. 85% of the erythropoietin is made by the kidney. If need more oxygen, if your body needs more oxygen, it will make more red blood cells. Okay, if you lose blood cells or kidney compensate, the kidney will compensate. Blood pressure regulation. Okay, we saw all that. Renin, angiotensin 1, angiotensin 2. Okay, aldosterone release and all that. Blood osmolarity. That's the absorption of the water. Okay, kidney is maintained an isotonic condition. Hypotonic will lead to hemolysis. That means if it's hypotonic, the blood will break. Okay, and edema, which is swelling. Okay, hypertonic would lead to lethargic, confusion, muscle cramping. This is where it's too dried up. Okay. Lastly, remember sodium, potassium, and calcium. Remember, sodium and chloride will most likely be reabsorbed, and potassium will be excreted. Calcium will also be absorbed. Okay. pH, it's important. We always got to maintain a regular pH, and that's what the kidney does as well. Well, in the lab, we'll show you several videos of more summary of this thing, and then if you have any question, you can just ask. Thank you.